Hello, welcome back. The topic today is the anemia series. Anemia. Can anemia be caused by stomach ulcer? The answer is it's a possibility. It can. Those days before the ulcer treatment, ulcer medicines were available. Most of the patients, are present to the doctor with ulcer and anemia. But with the advent of PPI and H2 blockers, that has come down. But still, there is a possibility. Okay, what is an ulcer? Ulcer is nothing but a wound in the stomach. Suppose I have a wound here, open wound here. I call that as an ulcer in the hand. The same way there is a wound or ulcer in the stomach. So stomach ulcer, gastric ulcer, duodenal ulcer, or generally peptic ulcer. Peptic ulcer means anything in the gastrointestinal tract. It's called peptic ulcer. What is the difference between an ulcer present outside and inside is inside there is acid in a day. Almost we are secreting 1 to 1.5 liters of acid. So this acid is always in contact with the ulcer, so it can erode the ulcer. It will stop the ulcer. It can stop the healing of the ulcer also. So the stomach and intestine has a very rich blood supply. The reason for the digestion and absorption of all the digested food nutrients. So that is the reason why whenever we have a good food or lunch or time, all the blood will come here. Oxygen, everything comes here. So you feel little, drowsy. The reason is that much of blood is coming to the intestine. So when ulcer is there, blood supply is rich and it's corroded by the acid, then it can sometimes bleed. Even if 1 drop per day in a year, it is 365 drops in a year. So suppose the bleeding is little higher, so the patient get easily anemic. So when the acid touches the ulcer and it's bleeding, the blood and acid join together form an acid hematin. So when it goes down, it becomes a black color. So black tarry stool or melena we call that. So when they lose blood, they can get anemia. This is number one. Number two, okay, somebody is diagnosed with ulcer and they're on treatment for prolonged period. They have a resistant ulcer and they're taking treatment for long time. See, these PPI and H2 blockers, they can literally reduce or even stop the acid secretion. But this acid is very essential for iron absorption, not only for iron, other nutrients. So when iron absorption is reduced for prolonged period, the ulcer patients can get iron deficiency anemia. The third reason, because of the ulcer, because of the pain and other things, they may not be able to have a good appetite. Their loss of appetite will be there, so they don't eat that much of food. So even if there is a 40 to 50% reduction in the food quantity, so the nutrients also, over a period of time, the quantity goes down, absorption is less, so they can get into anemia. So if you go to the doctor with anemia and black color stool, the first and foremost investigation they'll ask for is an endoscopy, because endoscopy will, directly we can visualize where exactly the ulcer, what is the type of ulcer, whether it's only ulcer or something else, whether it's bleeding. If it's bleeding, in the same sitting they can stop the bleeding, and any biopsy to be taken. All these things the doctor can do that. So if you have anemia and you look for the motion color, always whenever we pass motion in the morning, it's better to see the color of the motion, whether it's black color or fresh blood. That can give us what could be the reason for anemia. So if you have anemia, black color stool, immediately visit your doctor and get your ulcer treated. Thank you.